And once again, welcome to my Oet channel. Today, I will give you one critical task in Oet letter. So, this letter looks very easy, but really it is very hard to write. If you start to write, you will get the confusion. Anyway, we will have the discussion. First, as usual, we will go to the note. You are a school nurse at Western High School. Miss Ruben Philips is a student. She has been referred by her doctor for ongoing management and anxiety of her asthma and anxiety. So here you can see that you are the nurse, school nurse. Okay, and your patient is Miss Ruben Philips. She is a student. And another one more thing, she's already have asthma and anxiety disorder. So these many things you will get it from this note. Now we can go to the writing task. Using the information in the case note, write a referral letter to the student's family doctor, that means patient's family doctor, Dr. Silhout, for assessment and management of Miss Philips' worsening anxiety asthma. From here also you got the things that patient has two conditions, worsening anxiety and worsening asthma. And I have given the address, the letter to Dr. Silhout, 300 Main Street, West End. Okay. So anyway, we will, so actually the requirement, we can come to know that for further assessment and management only. Anyway, we will read from the starting and it is from here we can come to know that it is a noun case. Actually, no need to write any past history, but you can read once, then you can decide whether you have to write any past history or no. So because sometimes you will have the confusion whether to write the past history or no. So here they have given that patient's name is Miss Ruben Philips. I want to tell you something. Actually, the age, there is confusion. In my olden videos, I have mentioned that 18 and above is the age you have to mention Miss or Mr. the salutation. But actually, it is supposed to be 17. Okay, so 17 and above, you have to mention Miss or Mr. or Mrs. 16 and below, there is no need to mention the salutation. You can just write the full name in introduction and the first name in remaining paragraphs. So Miss Ruben Philips, aged 17, and address they have given. Social background is final year high school student, lives with both parents, good academic record. Medical history, it is more confused. Actually, patient had appendectomy. Then in 2010, it got happened. Then asthma, it is important thing. At the age of 13 years, she has had asthma since 13 years of age, and eczema also. It's like in childhood period. And they have given that important point. She got hospitalized 2 times in February and September 2018 during school exam. And actually today's date is 4 to 2019. So that means nearly 1.5 months before she got, that means 13 months, not 1.5, 13 months before she got admitted in the hospital because of generalized anxiety disorder. Later on they have mentioned GAD, that means generalized anxiety disorder. So we have two conditions. She has had asthma since her 13 years of age, and she has had generalized anxiety disorder since 13 months. Okay, so these two things you have to keep it in your mind, and these two things you have to mention it in the present medical paragraph. Okay, even patient family doctor knows regarding this condition, you can write, but you have to start with as you are aware. Then now we can see that the medical history revealed symptoms like difficulty in swallowing, hot flushes, lightheadedness, insomnia, difficulty in concentrating. So these all problem will happen when she will have this anxiety problem. And she is labeled as warrior by teachers and family, forced to resit exam in September 2018 following severe asthma attack. And they have given question mark triggered by GAD. That means due to exam fear, because of stress, she developed this severe asthma attack. So that most probably due to generalized anxiety disorder. Then, so she is on seretide metered-dose inhaler 125 by 25, fluticasone, propionate and salmeterol to puff daily. Then this is the her regular medication. And again in 9/9/2018, referral from family doctor. So here they have given full name, Dr. Dennis Silhout. So when you are writing the address, you have to write this full name. Okay, for counseling. Reason for referral is patient had 2 weeks history of headache, fatigue, muscle tension, increased anxiety regarding exam. Same problem regarding exam. So the management was anxiety relief, risk of decrease asthma attack. Anyway, 18/9/2018, again emergency appointment with the same problem, severe asthma to school management, ambulance called and progress, decrease oxygen and lung function, hospitalized for 3 days. So she missed school exam. So they have started oral prednisolone for 5 days. So during in this time, actually because of exam tension, she is developing this anxiety problem. Because of this anxiety disorder, her asthma became worsening. This is the reason for all hospitalization. And during this hospitalization for 5 days, they have given prednisolone. Keep it in your mind. This point is important. Then again, in 1/10/2018, doctor has reviewed asthma action plan and counseled on stress management. So on deferred exam. So they have postponed the exam to mid-October. She will sit in the next sitting. Then again, 25/10/2018, the same thing for anxiety, and they have given the follow-up visits. At that time, she got good exam results. They have continued regular fortnight meetings for ongoing stress management, including asthma management. So it's going on, same like this. Review and management. In between, they have explained advice regarding yoga classes, weekly yoga classes. Then the follow-up visits are there in November 14, November 30, December 13, December 27. So in these times and all, her condition became managed well. Then again, January 3, there was progress oral language exam for February. Again, next day there is oral language exam. So again, she is developing increased anxiety, headache, nausea, unable to concentrate. So GP has consulted. She was consulted by GP on 4th January. So she was commenced on Prozac 20 mg per day because of this anxiety problem. So management reviewed relaxation techniques. Then again, 28 January 2019, student reports feeling worse. She, however, felt irritable, crying a lot, insomnia, every problem returned back. So she's telling that this Prozac is not working. Then asthma review also is ongoing. Again today. So this is until here, GP knows everything. Until this point, everything is not valid to write actually. But if you want to write only for 4/2019, the incident on today, there is nothing to write in our exam. I mean, in the lecture. So what we have to do, we have to concise and we have to write this much things in the first paragraph. Then in the next paragraph, you can write about today's case note. Okay, what today happened? So she reported that oral exam got over and final exam will come within 10 days. So she has increased anxiety and all symptoms became severe, like difficulty in swallowing, hot flushes, not eating and sleeping properly. So by herself, she increased the dosage of Seretide puff to 4 to 5 puff. So this is by herself. Actually, it is advisable to take 2 puff, but she is taking 4 to 5 puff per day. This breathlessness is increasing during daytime. And she asked about prednisolone also. She requested about prednisolone because which helped her during hospitalization. So the evaluation is increased anxiety and poor asthma management, self-medicating Seretide above prescribed dose, and there is increased risk of asthma attack. So what is our conclusion is that because of her anxiety, increased anxiety and poor asthma management, and she is taking overdose of medication, everything it will leads to severe asthma attack, increased in risk of asthma attack. So further assessment and management is essential from patient doctor. So we plan that refer to doctor for urgent assessment and management, including review of Prozac. She is telling that Prozac is not working well, but we are suspected that there is side effect of Prozac. So we have to see whether is it because of this Prozac or it is because of her severity of anxiety. So whatever, we are referring her to his family doctor. So this is a noun case. So this is the content of the lecture. Actually nothing is there. In first paragraph, you can just concise all old histories in a concise manner, not in elaborated manner. In second paragraph, you can just write today's review. What are things that's happened today in the school and your concern. So these many things will come. There is no social paragraph. And a recommendation paragraph, you have to just write further assessment and management. You have to request further assessment and management. So this is the case note.